Good afternoon, everyone. My name is Shengxuan Jin, a PhD candidate from Southeast University, China. Today, it's my great honor to be here to present my paper titled "Multistage Mixed Method Research on Factors Influencing and Active Learning Intervention on Health Literacy of Community Residing Older Adults in Nanjing." My presentation will be structured into four main parts. First, the backgrounds. Firstly, as we all know, the health literacy has been identified as the cognitive and social skill which determine an individual's motivations and ability to access, comprehend, and use the information in a manner that promote and maintain good health. Unfortunately, low health literacy posed a significant health challenges in many countries, and the problem is even more pronounced among the old populations. China is currently experiencing an aging population. The number of individuals aged 16 and above has accounted for 19.8% of the country's total populations, and over the age of 65 presenting 14.9%. Age is a determination of health literacy and declines with age. Therefore, promoting health literacy is now a public health goal in many countries, and interventions to promote health literacy are often proprietized. To promote health literacy among older individuals, China has developed and implemented a series of policies. The 55 years plan for health aging is to enhance health education, and proactive health is fully integrated into Healthy China 2030 plan and Healthy China initiative, emphasize personal responsibility to proactivities. And active learning strategies are one of the key component works. It emphasizes individuals' initiative, optimize choice and personalities to the health benefit. After conducting literal reviews, we have identified several limitations in the current studies. Firstly, is the research on health literacy among older adults is insufficient, and many research focus on the relationship with health indicators and outcomes, lack of the current situation and problems for the old adult, and the activity health learning is a important part, but it's limited randomized controlled trials basis on the activity learning. Therefore, our study focused on firstly determine the current situations on the health literacy among old adults in the community, and explore the factor influencing health literacy, and design and evaluate an active learning health education program to improve health literacy. The second part is the material and the method. This was a multi-stage and prospective study. It includes the two stages. The first was a cross-section study. The inclusion and exclusion criteria is presented, and 608 adults were collected. And the second stage was a randomized controlled trial with 3 months interventions. 120% were selected. The questionnaire was developed based on the Chinese Ministry of Health questionnaires, and we reduced and adjusted for the older populations. This study employed the health literacy skills consisting of 5 dimensions in 20 items: health knowledge, health benefit, health behaviors, and health skill and health intentions. The Krombacher alpha is 0.78. The KMO value is 0.805. The statistic analysis was the peer t-test, and the independent simple t-test was used to compare difference in baseline and follow-up scores between the intervention and the control group, and the rapid adapted measure ANOVA were used to evaluate the group by time interactions, and the quantile regression, multiple linear regression also used. The results show that no significant difference between the control and the intervention group in the physical lines, and the health literacy scores show that mean score is 4.313, and the health behaviorals is the highest score for 4.698, and the health belief is the lowest. The quantile regressions shows significance value is gender, education, hukou, number of children, self-report health, and chronic disease insurance. The details in the figures, the male has a negative impact, and the effect increased, indicating a narrow gap. Education factors show the downward trends across quantile. Children numbers shows a negative impact at the 6 and 8 subpoint. The self-report health and had a positive effect. The resident physical measure, the medical insurance factor has a negatively affect, and the impact was narrowed and then large. The changes in health literacies between groups show that no significant difference were found in baseline score of the two groups. And in the intervention group show that all dimension scores improved compared to the baselines, and the control groups changed, but it was no significance. The rapid measure ANOVA show that the result has a group time interactions. And the factor affecting the effective of health, the total health literacy scale show that marriage impacts health knowledge, education impacts health behaviors and total health literacy. The chronic disease and insurance impacts the health scale. The gender and insurance impacts the health intention. The fourth part is the questions. The active learning program for health education has a great improvement in health intention dimensions. It supports proactive learning awareness and the concept of being the first to take response for their own health. However, the dimension of health behaviors shows a lowest improvement. It suggests that health behaviors may be influenced by multiple factors, making it difficult to change in a short time. It is recommended that the further health education efforts should focus on strengthening policies and skill educations on health lifestyle and health behaviors. The quantile regressions indicated that old adults with lower health literacy are more influenced by their own problems, while those with high healthy literacies are influenced by family and social influence. Therefore, more targeted health literacy guidelines for old individuals in communities should include family and social support. The analysis of health literacy effectiveness influence factors reveal that elders who married is improved better, and it may related to the family support from sports. The education factors indicated that older individuals with low literacy levels may benefit from the active healthy programs, while those with higher educations may have more confidence in their own health knowledge and may not experience significant improvement. At the same time, the result of health scale dimensions point to the influence of chronic disease and insurance factors. It is recommended to focus on the health condition of the elders and to design courses to improve skills related to the mental and physical health. The insurance factors show that resident physical insurance less capable of providing health coverage, but after receiving an active learning program, their willingness to pay attention to their own health may increase. The main strength of our study was launched a two-stage analysis of health literacy among older adults. The first part examined the factors that influence health literacy, and the second part established an active learning health education program under the concept of proactive health show great affections. Also, it has several limitations. The first is the control group did not receive any interventions. It's impossible to exclude the influence of participants' awareness. Second, the study was conducted only in Nanjing with a large urban population, which may make it difficult to reflect old people in rural areas. And secondly, the health literacy skills was self-constructed, and its generalization still need to be explored. Further study should include large sample size and longer follow-up period. That's all my pronunciations. Thanks for listening.